Okay, so I'm gonna start performing hand hygiene. I'm going to exercise my stethoscope. Okay, so my name is Jeremiah Bashford. I'll be a registered nurse for today. Can I get your full name and your date of birth?
Maya Bashford, June 2nd, 2006.
Okay, can I have your hand? Okay, so today I'll be performing a head-to-toe assessment on you today. However, during the procedure, I'll be touching parts of your body. If you do feel uncomfortable, do let me know, okay? Do I have your consent to start with this procedure?
Yes.
Okay, do you feel any discomfort before we start?
No.
Okay, sharing patient privacy. Okay, so the first assessment we're gonna do is just a general survey. So I'm gonna start with your physical appearance. I'm looking at your age, looking at your sex, you're a female, looking at your nutrition status, you look very healthy, you're slim to built. I'm looking at your hygiene, you smell good, and odor, you smell great, so that's good. The next assessment now is your body structure. I'm looking at your body build, I'm looking at your contour of your body, I'm looking at I'm looking at your contour of your body. I'm looking for any signs of any deformities. You have none, so that's good. And I'm just looking at your hair distribution as well. You have an equal amount of hair all over your body, so that's good. The next assessment now is your behavior. I'm looking at your speech. You talk well, so that's great. You're quiet, you're calm, you're collective, so that's also great. And you are maintaining eye contact with me as well, so that's also good. So that's another factor. The next now is mobility. I'll just need you to take a few steps for me, please. Okay, so your mobility is great, so you're very mobile, you can walk. And the next assessment, can you take a deep breath for me as well? Okay, so that's great. So that completes that first assessment. The next now is neurological and eyes. The first assessment now I'm going to try is your facial nerve. I'm just going to first start with the facial nerve, cranial nerve 7. I'm just going to just try with my hand, just to see if you feel that sense in your face. That's good. Okay, so I'm just going to need you to puff your cheeks for me. Release. Raise your eyebrows. Okay, smile. Smile, please. Thank you. Okay, and I'm gonna need you to close your eyes and please resist. Resist. Okay. Okay, that's great. The next assessment is her oculomotor nerve, cranial nerve 3, which is her eyes. I'm just going to take my pen light here. I'm just going to assess her eyes. I'm looking at her eyes. I'm just going against the gradient. I'm not going to go directly in your eye. I'm looking at her pupil. They're both looking at her shape. They're round. They're equal to each other. Her eyes are symmetrical. Her eyelash distribution are equal on her eyes as well. Now I'm just looking at her eye, her pupil. They constrict to light, so that's a good contact. I'm going to do the same for her other eye. Okay, her pupils constrict to light, so that's also good over here as well. Okay, so that makes up her eye assessment. Okay, the next now is I'm just gonna ask you a few questions. Can you tell me your full name?
Maya Bashford.
Okay, and can you tell me where we are?
The living room.
Okay, and can you tell me what time it is?
8:30.
Okay, that's good. So my patient is alert oriented ×3 to place, person, and time. So the next nerve now is ears, nose, and throat. I'm gonna inspect her ears. I'm looking at her ears. They're both symmetrical to each other. There's no signs of any discharge or any leaking. They're both symmetrical. I'm just gonna do a whisper test. So I'm just gonna need you to turn the other way. Hold your finger on your tragus, and I'm gonna whisper some words to you.
Bolton.
Okay, and I'm gonna need you to do the same for your other ear.
Toby.
Okay, thank you. So her whisper hearing, her vestibulocochlear nerve is intact, which is her cranial nerve number 8. That's good. The next thing now is her nose. I'm looking at her nose. Her nose is midline to her face. I'm looking for any signs of any discharge, any crusting. Her nose are patent, so that's good. The next nerve is her glossopharyngeal nerve, cranial nerve 9. I'm looking at her mouth. Can you please say ah? Can you please say ah? Okay, thank you. Just gonna take my pen light here. Checking her uvula and her soft palate. They rise while she says ah. Okay, her mouth is pink, they're intact. Yes, and her mouth is looking good, so that's great. Okay. The next assessment now that we're going to do is peripheral vascular, check her peripheral vascular and her musculoskeletal system as well. So just going to start anteriorly with her arms. I'm looking at her arms. I'm inspecting for color, looking for any lesions, any scars, any physical deformities, looking at her hair distribution. Everything looks good. The next assessment that I'm going to inspect now is I'm going to palpate your arms. I'm going to palpate. I'm feeling for texture, temperature, moisture, and feeling for your hair distribution. They're both even across your arms, so that's good. Okay, the next now is I'm going to now palpate her radial and brachial. Okay, start with the radial. Okay, her radial is +2. They're strong and they're both equal to each other. Do the same for her brachial. Okay. They're +2. They're equal to each other and they're strong. Okay, they're pulsating and strong. Next, bilaterally, I'm checking your capillary refill in both of your fingers. So they're, okay, within 2 seconds, they retract. So that's good. She doesn't show any signs of any cyanosis. Her breathing is good. In her fingers, her capillary refills are great. Okay, so now I'm just going to do some range of motion on you now. So I'm just going to need you bilaterally do what I do. I'm gonna need you to take both your arms. It's gonna be a physical exercise, and we're gonna start with abduction. Okay. Okay. So I mean adduction. So we're gonna start with adduction. So do this. Okay, and do this again. Abduct. Do you feel any pain? No. That's good. The next thing now that I'm going to now do is just going to need you to do your wrist. Can you extend your wrist for me? Okay, can you do this? Do you feel any pain here?
No.
No? Okay, and your elbow? Do you feel any pain?
No.
Okay, so she feels no pain in her range of motion. We're now gonna move to her bottom parts of her body. We're gonna go with her legs. I'm looking at her legs, I'm looking at her skin, her color, any signs of any deformities, any her hair distribution. I'm looking for any scars, any lesions. I'm going to now do the same thing I did anteriorly for your arms. I'm going to palpate. I'm feeling for temperature, texture, any masses, any inflammation, any edema. Okay, you're all good. So that's good. The next thing now I'm going to do is I'm going to check your pulse as well for your feet. Checking your dorsopedalis. Okay, pulsating strong. Bilateral. Okay, they're pulsating strong. Okay, they're both equal to each other. Doing the same for your posterior tibialis. Pulsating strong and both equal to each other. So that's good. Now, the next thing I'm going to do is do the same thing, range of motion for your legs. So this one, I'm gonna need you to get up for me, please. I will need you to just start with your knees. I'm just need you to just do this. Do you feel any pain?
No.
Okay, do the other leg. Do you feel any pain?
No.
Okay, and I'm gonna need you to do a dorsiflexion and a dorsiflexion. Do you feel any pain here?
No.
And the plantar flexion? Do you feel any pain?
No.
No? Okay, so that's good. Okay, so the next thing, you can sit down for me now. So the next thing that I'm going to do now is I'm just going to perform hand hygiene. Okay. So her next assessment now is lungs and thorax. So now we're moving to the next assessment. I'm looking at her chest diameter interiorly. Looking at her chest expansion. I'm looking for any physical deformities, any scars, any lesions. I'm looking for any. I'm looking for her hair distribution. If it's equal to her chest, everything's looking great. So now I'm going to palpate your chest. I'm going to start. I'm going to check for temperature. I'm checking for texture, moisture, and hair distribution is all looking good. And checking as well for any masses as well. I'll check for any masses or any inflammation. Do you feel any pain? No, okay, that's good. Okay, so that's good. So the next thing now after, after palpating, I'm now going to check her tactile firmness. So I'm just going to place my hands on your chest and I'm gonna need you to say 99 as I move down your chest, okay?
99, 99, 99, 99, 99, 99.
Okay, so our tactile firmness is great. The next assessment now is I'm going to check your breath sound. So I'm going to auscultate and I'm going to need you to say, I need you to breathe every single time as I move down your body, okay? Okay, so breathe in for me as I move the stethoscope, okay? So her bronchial sounds are very loud, which is great. Okay, her bronchovesicular sounds are loud with the soft sound to it. Okay, just gonna check here. Grief. Okay, and her vesicular sounds are very soft and quiet. So that's also good. Okay, so next now, just gonna perform hand hygiene again. Okay, so the next thing I'm going to do now is check your heart, okay? So I'm going to check your apical rhythm as well. Going to take my stethoscope again. Checking your aortic, pulmonic, Erb's point, tricuspid, or bicuspid or mitral valve. Okay, so the heart sounds are great, so that's good. Next, I'm going to be assessing your S1 and S2 sounds. So I'm just going to do that. So checking her S1 sound at the apex. Okay. Her S1 is loud at the apex, which is her lump sound. And her S2 sound is loud at the base, which is her dub sound. Okay. Next, I'm going to check for your apical rhythm in your apex, okay? So I'm just going to check your apical rhythm for 15 seconds, and I'm going to multiply it by 4, and I'm just going to assess your heart rate, okay? Okay, so your apical rhythm is good. So multiply by 4, so that her average of her heart rate is like 60 to 100 beats per minute for her age. So that's good. Next now, Next now I'm going to do is check for any heart murmurs. I'm just going to check with my bell. Okay. Okay. Checking for any heart murmurs. Checking out aortic. Mnemonic. First point. Okay. Bicuspid. Okay. So there's no any extra hard sounds or murmurs or any repetition sounds, I should say. So that's good. So that completes her cardiovascular assessment. The next assessment now we're going to do is your abdomen. So I'm just going to need you to lay in supine for me. Thank you. I'm just draping my patient. Is it okay if I lift your shirt for you? Okay. Okay. So, with only her abdomen exposed, I'm now going to look at her abdomen. I'm inspecting for hair distribution, looking for color. Her color is great. I'm looking for her shape. Her shape is flat. Her contour. I'm looking at her umbilicus. There's just a little hair over there. I'm looking at her. There's no signs of hernia, so that's good. I'm looking at her midline. They're symmetrical to her body, so that's also good. So next now I'm going to do is auscultate your abdomen, starting with the right lower quadrant. So I'm just going to check for your bowel sounds. Okay, that's good. So your bowel sounds are great. There's no extra sound that sounds abnormal. So your bowel sounds are good. The next thing that I'm now going to do is I'm going to lightly palpate your abdomen. So I'm going to palpate your abdomen. I'm checking for any masses, any tenderness, any inflammation, any edema. Okay. Okay, everything is good. And lastly, I'm going to palpate her bladder. Okay, lightly palpating her bladder area. Everything is good. So that's good. So I'm just going to cover my patient up. Okay, so you can now get to a prone position for me. You can get into sitting position. Okay, I'm just going to perform hand hygiene. Okay, how was the assessment?
Good.
Okay, so thank you once again for performing this assessment with me. It was great doing my head-to-toe assessment with you. Thank you for watching.